Hello, Norman Enriquez here again today to discuss with you the treatment of chronic pain. Chronic pain is pain that persists longer than 3 to 6 months beyond the original injury or anatomy damage that's occurred to an individual. When patients have this kind of pain, it's quite disabling, discouraging, and depressing. We know that some 100 million Americans suffer with chronic pain and are suffering with disability and unable to return to work. So when a person suffers with chronic pain, it's no surprise that they also exhibit symptoms of depression, insomnia, lack of hope, lack of social involvement. So what psychologists tend to do to try to help patients with the depression is to help identify the distortions or catastrophic thinking that they may be engaged in regarding their condition. Some of the assumptions that they have are pointed out to be illogical and distorted, and there's a possibility that the way they're viewing their situation is not helpful. We also work with their nervous system because we know that this conditioning process, which is called central sensitization of the nervous system, allows the nervous system to be so sensitive that one minor little twinge, ache, or pain can bring on the full body sensation of severe and profound pain. It's as if the nervous system is sensitized like a hypersensitive alarm system that goes off, and then a patient is really struggling and discouraged because of that hyperreactivity. So we know that it's important for patients to pay attention to the body, and in order to do that, we teach them mindfulness or body scans and relaxation, so there's a way that they can relax and calm the nervous system so that this alarm mechanism isn't going off so readily. We also encourage appropriate activity. We don't ask these patients to go out and exercise rigorously because that would be quite self-defeating, but we do encourage them to do activity that is appropriate for their current level of functioning. We also encourage them to make sure that they have appropriate social interaction and get support from friends and loved ones. If they can redirect their attention to activities that are still meaningful and hopeful and have something to look forward to, they do much better in treatment. We encourage patients to continue taking their medications as prescribed by their physicians and to not change or decrease any medication without consulting their physicians. I offer individual and group therapy for these patients. The group therapy provides support and models for others, how they've managed the treatment and how they've managed the illness. And individual therapy, we work on these skills in the trusting alliance of one-on-one therapy. Thank you.